Hello everyone, myself Dr. Parth Goswami and today I am going to teach you about fungal infection in the detail. First of all, I am sorry that I could not able to post a video since a long time. But now let's begin with new topic, that is fungal infection in a pathology. So our learning objective or the index of today's lecture is, first of all, we will see the introduction or the definition of fungal infection. Then I will teach you about the morphological types of fungal infection, and then we will discuss the etiology, mode of transmission, and in detail about the pathology of common fungal infection, particularly candidiasis, histoplasmosis, cryptococcosis, aspergillosis, and mucormycosis. So first of all, let's begin with an introduction. What do you mean by fungus? So first of all, let me know you that all the fungus, large number of fungus exist in our community, but only few are infective to the human beings. Like, right? We daily eat mushroom in our diet. The bread contain the fungus. So lots of the fungus are present in a large number, but they are not pathogenic because they doesn't produce mycotoxin or our immunity can combat it. But few fungus are very infective and they will infect us, especially when immunity is low. So many fungus are opportunistic one. Opportunistic means they will infect you when your immunity is down, when your T cell function is at the defect. That is particularly observed in case of an HIV. In HIV, the master T regulator lymphocyte, particularly CD4 T helper cell, is not working well. In the diabetes, immunity is low. Obviously, neutrophil function defect. If your neutrophil is not functioning well, then phagocytosis could not be possible. Steroid and immunosuppressive therapy will reduces your immunity. So in such condition, you are more prone for development of fungal infection, particularly opportunistic fungal infection by Cryptococcus, Candidiasis, or Aspergillus. And all the fungus are eukaryotic. Eukaryotic means they will have a nucleus, membrane, and they will have organelles as well, like that of mitochondria or the Golgi apparatus, right? So they are eukaryotes, and they need oxygen for the survival, right? So they are aerobic organism. Now, how fungus growth, based on which we will divide the fungus into two category. So if the fungus grow as a multicellular filaments, right, then they are known as a mold. But if they grow as an individual cell or in a chain, then they are known as a yeast form, right? So in a yeast form, they will reproduce by the budding or binary fission. So in short, they will grow in a two form. The first one is yeast and second one is mold, that is hyphae. So this is the yeast form. You can see that if the fungus grow as a yeast form, they are round and unicellular. You can see it is a round, right? They are round, single cellular, and they will reproduce by a budding or binary fission. So they will grow as a budding. You can see a bud here attached to the membrane. It's an identical bud, right? The identical part developed from the extrusion of cytoplasm. So the yeast will grow as a budding form, right? Or binary fission. The common example of yeast form is Cryptococcus neoformans, which is notorious to lead a development of meningitis in a HIV patient. So Cryptococcus neoformans is an example of growth as a yeast form in which they will reproduce by budding, right? They are round to oval. You can see in this diagram, round to oval. But now usually what happens, see, this budding will be separated from the main cell, and so from one cell there will be two cells, and in such a way from 2 to 4, 4 to 8, right, that of division will occur. But some yeast produce a bud that will not detach from the wall. Means this bud will not detach from the wall, and they will produce a elongated chain, right? They will form a elongated chain of yeast. This bud is not separated, constant budding is going on, and they will produce a chain of yeast which is known as a pseudo hyphae. Means it is not a hyphae form, it is not a filamentous form, but they mimic like that of hyphae. That's why known as a pseudo hyphae form, and the example of such category is Candida albicans. So now it's clear that yeast form, the common example is Cryptococcus. Another category of yeast form is that they can produce an elongated chain without separation of budding, that is known as a pseudo hyphae. Example is Candida albicans, right? So this is the pseudo hyphae, right? But okay, but second form of growth is a hyphae. If the fungus grow as a filamentous form, thread-like filament, then they are known as a hyphae form, right, or mold form. So see, this is the hyphae. This is the hyphae form, right? They will grow and divide at their tips. They are multicellular. See, you can see a multicellular organism. See, this is the multicellular, right? So multicellularity is a feature of mold, hyphae. See, it's this is a unicellular, but hyphae is a multicellular and multiple nucleus. You can see it. Now again, they could be of two types. You can see a septa here, right? So that is known as a septate hyphae. But if septa is absent, then aseptate hyphae. right? So septate or aseptate hyphae is a further division of mold. Now, the interesting feature is that, which is important in a pathogenesis of the fungus, is that they will produce a round cell, particularly conidia. See, this is the conidia, micro or macro conidia. So these conidia will help in a fungus transmission. Airborne transmission of conidia can occur, and so fungus disseminate from one particular person to another person, right? The example of filamentous fungus is Aspergillus and dermatophytes. All right. Now, third category of the fungus growth is a dimorphic fungus. So, what do you mean by dimorphic fungus? Like that of Iron Man, it exists in a two form. If they grow as a yeast as well as mold, if both form is seen based on the environmental condition, then it is given the name dimorphic fungus. They will usually grow as a yeast form. They are present as a yeast form at our human body temperature 37 degree, and at the room temperature they will grow as a filament mold. So that is known as a dimorphic fungus. The common example of dimorphic fungus is a Histoplasma capsulatum, blastomycosis, and coccidiomycosis. All right. So these are the three main category of fungus growth, either as a unicellular yeast form, or as a filamentous hyphae form, that is mold form, or they will grow as a dimorphic fungus. All right. Now, that was a classification based on the growth. But according to the site of infection, they can be categorized into four forms. The first one is superficial or cutaneous mycosis, means they will infect. The infection is limited to the skin, hair, or nails, like that of superficial tissue. That's a very common one, particularly dermatophytes, right? The ringworm, tinea infection are the example of superficial mycosis. If fungal infection invade the subcutaneous tissue or lymphatics are involved, then it is subcutaneous mycosis. If fungus infecting, particularly when your immunity is down, when the person is immunocompromised, like that in a HIV, diabetes, right, or steroid therapy, immunosuppressive therapy, then they will infect you. That is opportunistic fungus infection, and they are very life threatening because they can lead to systemic metastasis, right? So person can die if it is not treated early. An endemic mycosis, that is caused by dimorphic fungus, means the infection can occur in a healthy person as well if it persists in a community, if it is endemic. All right. So the example of cutaneous mycosis is tinea, right? The three fungal species lead to cutaneous infection. They are known as a dermatophytes, right? They are known as a dermatophytes. So the example is trichophyton, epidermophyton, and microsporum. These three species are the dermatophytes, and they can lead to particular disease development based on the affected area. So if cutaneous mycosis, if trichophyton, if dermatophyte infection seen in a toes area spreading to the nail, then it is known as the athletic foot or tinea pedis. If it is seen at the area of trunk, then it is known as a tinea corporis or the ringworm. If it is infecting your scalp lesion, in which patient will manifest as a hair loss, then it is known as a tinea capitis. If it infect your thigh or genitals, then it is known as a tinea crudis or chalk itch. And if your nails are thickened and brittle, if the nails are infected heavily particularly, then it is tinea unguam. So these are the example of cutaneous mycosis. The example of systemic mycosis are histoplasma, coccidio, and blastomycosis. These three are the dimorphic fungus, if you remember. And the blastomycosis can infect your skin, bone, and the genitourinary tract. Coccidiomycosis particularly lead to infection of the CNS and bone, while the histoplasma infecting the liver, spleen, and bone marrow. Particularly, they are infecting reticular endothelial cell macrophage in this organ. The example of opportunistic fungus are the Aspergillus, Cryptococcus, Candida, and the Esopus, right? Rhizopus. So these are the example of opportunistic fungus. It's a most important MCQ, can be asked in your variety of exams, right? So remember opportunistic pathogens: Aspergillus, Cryptococcus, Candida, and the Rhizopus or mucor, right? And based on the etiological agent, the disease is given different name. For example, if patient develop Aspergillus infection, then the disease is known as Aspergillosis. If Rhizopus mucor infection, then it is known as a mucormycosis. If infection by blastomycus, then it is the disease develop is known as a blastomycosis. If Candida infect you, then it could be candida. Then the disease known as candidiasis. If infection by histoplasma or cryptococcus, then the disease is respectively known as histoplasmosis or cryptococcosis. All right. I have taken this diagram from the Hersman book. All right. So how to diagnose the fungus infection? We might have query that okay, sir, it's right that fungus can grow in a variety of forms, right? But how will you identify? How will you diagnose? So first of all, you will take a clinical history, and then you will do the clinical examination because the certain fungal infection affecting a particular site, right? So see, this is the ringworm tinea corporis infection, in which you can see a round lesion, erythematous lesion seen over the skin area. This is the ringworm of corporis area, right? Trunk area. Okay. Now, after clinical suspicion of fungal infection, if you are not sure, then you will take a biopsy and send it for histopathological examination. Direct microscopy also will help in its diagnosis. You can do a culture from the affected tissue. And finally, serological test. Particularly, we can detect the antibody against the particular antigen of fungal cells by ELISA or chemiluminescence type of test. So in that way, you can diagnose a fungal infection. All right. So now first we will begin with candidiasis. We will discuss the common fungal infections, not all one, but we will discuss the common fungal infection in a detail. So first we will begin with Candida albicans, candidiasis. You won't believe guys, it live as a normal commensal in our body. They are particularly live as a normal commensal in our skin, mouth, vaginal tract, oral mucosa, gastrointestinal tract, like that of area. So in a healthy individual, they live as a normal commensal. And the infection occur when there is a breach in the skin or mucous membrane. For example, if you have a mouth ulcer, then you are at a prone of development of candidiasis. If the skin is broken, then also there is a chance of infection by candidiasis. So breach is needed or defect in a epithelialization. The causative organism for this infection is Candida albicans. Now you know how they will lead to infection. What is the pathogenesis? So they will infect you because they can adhere in your cell. They can produce a adhesin. Adhesin is having integrin like property. If you remember the chapter of acute inflammation, then neutrophil attached to the endothelium by integrin. So integrin like property acquired by candida by production of adhesin, so they will attach to the host cell, and for the invasion they will produce a various enzymes. So in that way they will invade the tissue by enzyme, right? All right. So candidiasis can be divided into superficial or deep or disseminated candidiasis. Superficial one means they will infect a superficial tissue, particularly skin, oral mucosa, like that of tissue. They will not disseminate to the various organ. The common site is oral thrush, over the tongue. Here you can see a fungal infection, candidal infection over the tongue, right? They will form a grey white dirty pseudomembrane. That's because of dirty material and by fungal infection. The pseudomembrane is formed over the tongue. All right. Susceptible individuals are obviously the individual with low immunity, right? If your immunity is low, then it is one of the opportunistic infection. For example, diabetic patient, HIV patient, those who are on antibiotic or steroid, or AIDS patient, right? Interestingly, if asthma patient regularly taking steroid, particularly by meter dose inhaler, and if they don't do the gargle, if they don't do the mouthwash after steroid intake, right, after inhaler intake, then there are more chance of candida infection, right? All right. Now, in a AIDS patient and hematological malignancy, particularly leukemias, the Candida infection seen in the esophagus area, that is known as esophagitis, right? Candida esophagitis. Candida vaginitis, the vaginal infection, particularly seen in diabetic woman, in a pregnant lady, and lady who are taking OC pills. In a pregnant lady, it is commonly seen, right? That's why clotrimazole tablet prescribed for a lady who is having candidiasis. It should be put in a vaginal area high up, right? All right. Cutaneous candidiasis, the examples are nail, hair follicle, or armpits. Penile skin sometimes also can be infected. That is known as a balanitis, right? Fungal balanitis can be seen. In a children, if they are constantly wearing diaper and if it is not getting changed when it is dead, when it is wet, then diaper rash can develop. See, this is the candidal infection. All right. Disseminated candidiasis means the candida will disseminate in a blood and spread to the various organ. It particularly develops in a patient having IV lines catheter or peritoneal dialysis. Severe neutropenia is a predisposing risk factor for the dissemination of this fungus. If your neutrophil count is very low, less than 500, then dissemination can be seen. The complication is that they will lead to endothelial injury in a variety of blood vessels in a variety of organs, and DIC and shock can occur. So ultimately, patient can die if not treated. All right. Morphology of candida. If you take a biopsy and examine it histopathologically, then candida will go as a pseudohyphae, as we have discussed. So yeast bud are seen as well as pseudohyphae form are seen. Septae are obviously absent because they are not a hyphae. So that will help in differentiating it from a filaments. They is seen at affected organ. See, this is the candida, right? These are the yeast bud. So these are the yeast buds. All right. Now let's discuss about the second fungus, that is the Cryptococcus. So this is all about the Candida. Now about the Cryptococcus fungus. So this fungus will grow as a which form? They will grow as a, you are right, yeast form. So this is the yeast form. Now two particular species can infect the human and lead to disease development: Cryptococcus neoformans and Cryptococcus gattii. Cryptococcus neoformans is present in a soil and a pigeon dropping, right? They are present in a soil as well as pigeons dropping. They will spread through the inhalation. So from one person to another person, they will spread through the respiratory tract by aerosol transmission. And particularly in a HIV leukemia like that of patient or those who are taking steroid, they can lead to opportunistic infection, and particularly they will lead to infection of a meninges, that is known as a meningitis. The second form of Cryptococcus infection is Cryptococcus gattii. They are usually found in a soil, and a mode of spread is similar to that of neoformans, that is by inhalation, and they will form a mass in a lung, right? So aerosol spread is a common one for Cryptococcus fungus, like that of another fungus. Alright. Now, what is the pathogenesis or what is the virulent factor in a pathogenesis of Cryptococcus? You know, that will help in evasion of our immunity. How they escape from our immunity. So three main factors are there. First of all, the first virulent factor is polysaccharide capsule. You know, the Cryptococcus is having a very thick capsule. You can see that very thick capsule is seen here. See, this is the capsulated organism. This is the capsulated yeast form, right? They have a capsule, thick gelatinous capsule. This is a special stain that was used for the detection, PAS stain, right? The periodic acid sieve stain. So it demonstrates a thick capsule. So the first virulent factor is capsule. You know the what is the role of capsule in evasion of immunity? So you know the capsule will hide the antigen, right? Of the fungus. So you know in that way they will escape the phagocytosis, because phagocytosis can happen only if the receptor over the antigen or antigenic receptor over the fungus infection is recognized. So here it will not recognize because of capsule. So you know phagocytosis will be escaped. So in that way they can lead to infection, right? Because we know that phagocytosis is the main event in our body that will help in elimination of organism. Alright. In addition, capsule will help in the escape of the leukocyte recruitment. Second factor is melanin production by leakage in the yeast. You know they will reduce the phagocytosis of our immune cells. Then antioxidant property, you know melanin production will having antioxidant property. They will help in iron binding and provide a cell wall integrity. So they will also help in evasion of our immunity. And the third factor is enzymes, particularly serine protease, that the proteinase that will help in tissue invasion. Mannitol dehydrogenase enzyme will lead to mannitol production that will lead to osmotic edema formation. So in that way they will inhibit the killing by neutrophil and reactive oxygen species. So these are the virulent factors that help in a evasion of our immunity and lead to infection in our body. The main factor is capsule, right? That will help against the infection. That will help against the phagocytosis. Alright. So which are the sites that is involved by cryptococcosis? So commonly it involves lung, central nervous system, liver, spleen, adrenals and the bone. Particularly it infects the meningitis, particularly in patient of HIV. So in a HIV patient, whenever there is a fungal infection, fungal meningitis, the common cause is cryptococcus. That is the important MCQ. Alright. Now morphology. In a histopathology, how they looks like. So they are yeast form. You can see a yeast, right? Round yeast, round oval. So that easy to identify. A reaction, chronic inflammatory reaction can occur surrounding this yeast form, particularly lymphocytes and the fibrosis, right? They have a thick gelatinous polysaccharide capsule, which can be better demonstrated by PAS stain or mucicarmine stain. In a PAS stain, you can clearly see a vacuum capsule here with, right? Okay, in an Indian ink preparation, they will shown as a negative image. Negative image seen capsule with a clear halo within the dark background. So here within the dark background, you can see a capsule with a clear halo surrounding it. That is Indian ink preparation. The PAS stain again, Again, the photomicrograph of a past stain demonstrating Cryptococcus fungus infection. This is the thick gelatinous capsule. You can clearly see a capsule, right? Alright. Now the third infective fungus is Aspergillosis. We have dealt with Candida and the Cryptococcus. Now we will discuss about Aspergillus fungus infection. So it's a ubiquitous mold. Mold means they will grow as a filaments. They will grow as a filamentous fungus, right? And the common species infecting the human beings are the Aspergillus fumigatus. The infection caused by it is in a lung, that is known as a allergic bronchopulmonary aspergillosis, in which they will form a brown mass in a lung. They can in fact affect our sinuses as well, which is known as a sinusitis infection. If they infect the lung in a form of a lung parenchymal infection, then it is pneumonia, right? Pneumonia also can occur. And in an immunocompromised individual, obviously, it is an opportunistic fungus, so it can disseminate systematically, particularly in an immunocompromised patient. So it is also one of the opportunistic fungus. Now, what is the pathogenesis? So the portal of entry is a lung by aerosol transmission. Particularly, aerosol transmission occur by conidia. Right? In an earlier slide, we have seen that conidia produce from the fungus by certain fungus. So conidia will help in transmission of this aspergillus fungus. And our alveolar macrophage recognize this particular fungus by toll-like receptor 2 and lactin 1 receptor and kill the candida of Aspergillus, conidia of Aspergillus, right? So our macrophage plays a very important role in killing of this organism. So if our macrophage are not functioning well, if our immunity is low, then you are prone for the development of this fungal infection. In less immunity, they can disseminate. Aspergillus, however, produce a variety of virulence factor as well, like that of adhesin for the attachment to the cell. They are having antioxidant property as well, and they will produce the enzyme, particularly protease and phospholipase, right? Protease will lead to protein damage, and phospholipase will lead to lipid damage of a cell membrane, and they will produce a toxin as well. So in that way, they will, by this virulent factor, they will disseminate in our various organ. Alright, so three particular infection caused by Aspergillus, that is the pneumonia, lung infection, sinusitis and allergic bronchopulmonary aspergillosis. Interestingly, this particular fungus can lead to liver cancer development as well, particularly by production of aflatoxin. So, this particular fungus can grow on a surface of improperly stored peanut. If peanut is not stored properly, then they can grow over their surface. They will produce the aflatoxin and lead to liver cancer formation. Now, morphology of Aspergillus lung infection, particularly Aspergilloma. In a histopathologically, if you observe carefully, then grossly they will form a brown colored mass which can be seen in an autopsy of a lung whenever it is received in a dead person, right? Autopsy means examination of organ in a dead individual. So, in a lung, because of tuberculosis, because of bronchiectasis like that of disease, infarction, abscess, abscess, that is a heavily bacterial infection in a lung. So in this condition, the cavity in a lung can form. They can lead to tissue destruction. So the cavity will form in a lung. And in this cavity, aspergillus can grow in a hyphae form and simultaneously ultimately lead to development of brown colored mass, which is known as a fungus ball. And that particular infection is known as aspergilloma. In this individual, if the patient lung is infected by aspergillus, then patient will complain hemoptysis, difficulty in breathing like that of complaint. Cough can also be there, right? Low grade fever is seen constantly. Hemoptysis means blood in a sputum. So in a cough, they will have a sputum. In a cough, they will have a blood. All right. Now, aspergillosis can be demonstrated by a Gomori methamine silver stain, which is a special stain for its demonstration. Gomori methamine silver stain. It will stain the fungus black colored. You can see a hyphae that is stained as a black color, and this is particularly septate hyphae, right? The aspergillus is a hyphae, and they will be grow as a septate hyphae, septate filament. You can see a septa. This is the septa, right? And this is a filamentous fungus. So the goemorrhea methamine silver stain it a black colored. They are 5 to 10 micrometer thick, and they will branch at an acute angle. If you observe carefully, they are branching at an acute angle. See, they are branching at an acute angle. In this diagram, you can see that they are branching at an acute angle. This is a bronchio-alveolar lavage washing specimen, which demonstrates Aspergillus. Alright, now another fungal infection that can infect the human being is a mucormycosis. This is very rare fungal infection, but you won't believe it is very serious, life-threatening fungal infection. It is caused by a mucormycete mold. They will grow as a filament. They are known as a mucormycete, also known as a zygomycosis or a black fungus. They are present in our environment. This particular fungus was very famous during the COVID time. During the COVID pandemic, patients were haphazardly taking steroid in a high dose, and because of high dose of steroid, their immunity were low, and because of that, they were infected with a mucormycosis. And particularly, it was observed in a patient of diabetes, in which additionally immunity is low. So, in a diabetic patient taking high dose of steroid, were commonly infected by this particular fungus. Alright. The four species implicated commonly, that is, four species of mucormycete implicated commonly in a human infection: Rhizopus, Absidia, Mucor, and Cunningham. The source of infection is our environment, right? Dirty environment, soil, damp wall, old building, dirty instrument. So they will grow ubiquitously over the environment, over the soil, over the damp wall, over the dirty instrument, over the dirty N95 mask. So they will grow in that way. They can infect at a various site, and accordingly they are classified, right? If they infect our respiratory tract and cerebral system, then it is rhinocerebral. If they infect lung, then it is pulmonary mucormycosis, GIT mucormycosis, in which infection of a colon is seen. Disseminated means they will disseminate in a various organs, multiple organs are involved. And if they infect skin, then it is known as a cutaneous mucormycosis. See, the most common organ involved are the sinus, brain, and the lung. These three organs are commonly involved by mucormycosis. And during the COVID pandemic, many patients' brain and the sinuses were infected if their immunity is low and if they are haphazardly taking high dose of steroid without doctor advice. So that was very common at that time, right? And it is a tissue destructing black fungus. They can invade the blood vessel, they can damage the endothelial cell, so blood clot will form because of the endothelial injury. The coagulation system in our body is activated, and ultimately clot formation can be seen, which can hamper the blood supply of a affected area. Because of clot formation, obviously blood supply is affected, and so there will be tissue death of that affected area. That's why it is known as a tissue destructing black fungus. They will give a black discoloration to the affected tissue, right? So what are the clinical features? So clinical feature of mucormycosis is according to the site of involvement. If they involve sinuses, if they involve the periorbital region, right, then facial swelling is seen. If meningitis, CNS infection is there, then headache can occur. Periorbital swelling can be seen. If the tooth is infected, then gingival abscess can be seen. Nasal and sinus congestion seen when upper respiratory tract is involved. Tooth abscess can be seen if the tooth is infected and pus discharge from that occurred. You can see a black lesion here with. So black lesion can be seen on the nasal bridge or upper inside of the mouth because it's a black fungus, tissue destructing fungus. Palate discoloration is seen if you are infected, if your sinuses are infected with mucormycosis, right? High grade fever is seen in mucormycosis. In a pulmonary type, patient will complain fever, obviously cough, chest pain, and difficulty in breathing. In a GIT type, the patient will have abdominal pain, diarrhea, and the vomiting. In the cutaneous type, you can see a black colored ulcer, redness and swelling, inflammation sign, the signs of inflammation seen around the ulcer. The risk factors are obviously it is one of the opportunistic fungus infection. Candida, Cryptococcus, Rhizopus, Mucormycosis, Aspergillus are the examples of opportunistic infection. So they will infect you when your immunity is low, particularly in AIDS patient, diabetes, cancer patient, long-term steroid use in that way. In the COVID time, the reuse of dirty mask was a common implicable factor as well. Iron overload, excessive zinc use also can put you at the risk for the development of mucormycosis. The surgery with a dirty instrument, burn or wound patient contaminated with soil, they can get infected with mucormycosis. And if you do the histopathological examination, which is necessary for its diagnosis, usually histopathology examination is done. You take a biopsy from the infected sinus, you do the sinus scraping, functional endoscopic sinus surgery when the patient is having sinusitis, and it should be sent to the histopathology lab for the examination. And in a histopathological examination, you can see a broad filamentous fungus. They will grow as a mold. CT scan and MRI scan of the paranasal sinus can be done to find the extent of involvement, right? So these are the broad fungus. If you observe carefully, they are very broad. They are aseptate and grow as a filaments. Aggressive surgical and medical treatment is necessary in case of a mucormycosis. The fungus ball from the infected tissue need to be removed, or else it will spread in a various organ and the patient will die. If eye is involved, sometimes surgical removal of eyeball is necessary. If the sinus are involved, then functional endoscopic sinus surgery and the debridement of the sinus is necessary to remove the fungal tissue, right? The antifungal that can be used for its treatment is intravenous amphotericin B, posaconazole, and isavuconazole. That can be given orally or intravenously, and the treatment might need to be given for 1 month, right? 3 to 4 weeks. And during that therapy, while the patient receiving amphotericin B, kidney monitoring is needed, right? They can lead to kidney impairment. They are nephrotoxic drugs. So creatinine and electrolyte estimation, particularly create estimation, needs to be done to check the kidney involvement when you are on a amphotericin B, when the patient is put on amphotericin B treatment. So creatinine need to be checked to detect the kidney impairment. Prevention is that your immunity should not go down. Use the steroid judiciously while infected with COVID. Wounds should be clean and dust free. Take the steroid only after prescription of doctor. Avoid direct contact with a lots of dust like that of construction, water damage building, accidental disaster. Wear the shoes, full sleeved cloth while doing the outdoor activity. Sugar should be controlled. So all these, use clean sterile water for the humidifier while you are on oxygen therapy. So if you are on oxygen therapy, clean sterile water need to be used in humidifier. So in all that way, you can prevent the infection by mucormycosis. Prognosis is very poor. That's why I have discussed mucormycosis in detail. Right? In a AIDS patient, mortality is nearly 100%. 100% patient will die. In a rhinocerebral type, mortality is 30 to 70%. And in a disseminated, mortality is near 100%. That is 90%. Prognosis is not good in a mucormycosis. Right? All right. Now the last fungus is Histoplasma capsulatum. So they are an intracellular infective organism. They grow intracellularly, and particularly they affect the reticuloendothelial cell system. They affect the macrophage. They grow as a dimorphic fungus. Yeast as well as a mold form can be seen. This organism is present in soil, bird feces, and rotting trees. Majority are the asymptomatic. But sometimes patient have clinical feature according to the organ involvement. Patient can have fever, patient can have anemia. If the liver is infected, then patient will have hepatomegaly. If spleen is infected, then splenomegaly. Patient will complain mainly fever. And investigation is that, if you take a histopathology, if you take a biopsy and do the histopathology examination, then fungus is present inside the phagocytic cell. So inside the phagocytic cell in the liver, you can see a histoplasma capsulatum, right? Capsulated histoplasma. In a human body temperature, they will grow as a yeast form. So you can see a yeast form in a reticuloendothelial cell. See, these are the fungus in a reticuloendothelial cell. This blue nucleus is of macrophage. These all are the macrophagic cell within which you can see a histoplasma capsulatum. Rhizopus. They will grow as a broad ribbon-like hyphae branches at a right angle. The branches are at a right angle. See, these are the right angle, right? Okay. See, these are the microconidia and this is the macroconidia, right? Which will help in fungus transmission by aerosol. Alright. Now let's see some of the MCQs. That's all about the fungal infection. We have discussed about the all fungal infection, particularly common fungal infection. We have discussed about how the fungus grow as a mold or yeast form, right? This is the yeast form, then hyphae is a mold form, dimorphic fungus. We have discussed the type of fungal infection, particularly cutaneous, systemic, or opportunistic. In which opportunistic one is important, particularly Cryptococcus, Candida, Aspergillus, and Mucormycosis, right? Uh, we have discussed something about the Candida, which is grow as a pseudohyphae. We have discussed about the Cryptococcus. We have discussed about the Aspergillus. The special stain used are the past stain or gomorimethamine silver stain. We have discussed about the mucormycosis, and finally we have discussed about the histoplasmosis, right? All right, now let's see the MCQ. Which of the following fungus is a dimorphic? Candida, crypto, histoplasma, or tinea? So obviously your answer should be histoplasma. Histoplasma, blastomycosis are the example, or coccidiomycosis are the example of dimorphic fungus. Which of the following is a special stain to demonstrate the Aspergillus fungus? So the answer would be the silver stain. Which of the following fungus demonstrate a yeast with a capsule and clear halo around the Indian ink preparation? Around it in an Indian ink preparation. So Indian ink preparation is commonly used for Cryptococcus, right? Which is having a thick polysaccharide capsule. Clear halo is seen. Alright. Now 10-year-old girl with a leukemia undergoes hematopoietic stem cell transplantation. She has a poor engraftment and 1 month later she develops fever dyspnea. On physical examination, her temperature is 39. On auscultation on the chest, wheezing and crackles are heard in the both lungs. So obviously it is indicating lung involvement, right? Chest CT scan shows nodular lesion accompanied by cavitation, hemorrhage and infarction. So we are dealing with cavitary lesion. Laboratory studies shows hemoglobin 8.8, hematocrit low, platelet low, and WBC count low. Patient is leukopenic. WBC count is low, so that indicates that the immunity is affected, right? So opportunistic fungal infection that involve the lung could be implicable factor, and 2% band cell, 70% bronchoalveolar lavage is performed, and the fluid was stained with gomorimethamine silver stain and analyzed microscopy as shown in the figure. Which of the following infectious agent most likely to produce this finding? So first, here the clue is that lung is involved, particularly cavitary lesion is present, and the patient is having leukopenia. So it's an opportunistic fungal infection infecting a lung with low neutrophil in a leukopenia, in a cavitary lesion. And here you can see a hyphae. So this could be a case of Aspergillus. Histoplasma grow is a yeast form, and trichophyton usually doesn't infect the lung. So the answer would be Aspergillus. Obviously, it's not a tuberculosis, right? In which granulomides seed. So the answer would be Aspergillus, which grow as a filamentous fungus. All right. Now again, interesting case. This is the problem solving MCQ. Such type of MCQ can be asked in an exam. So 24-year-old woman has noticed a worsening pain on the right side of her face for the past 24 hours. On examination, there is marked tenderness and swelling inferior to the zygomatic arch and lateral to the nasolabial fold on the right. Laboratory study shows WBC count 9,900, serum create was high, then CT scan shows soft tissue swelling and bony destruction around the maxillary sinus. So we are dealing with a infection of maxillary sinus, right? The sinus infection is there. A biopsy was performed. Figure shows photomicrography attached, which shows organism, right? So what could be this causative organism? So see, this is the broad hyphae, broad mold, right? It's not a narrow like that of Aspergillus. It's a broad hyphae, an aseptate hyphae. So obviously your answer would be mucormycosis. It could not be Candida or Cryptococcus, which grow as a yeast form. Here you can't see a yeast form. So the answer would be mucormycosis. So these are the references for my book, right? Robbins, Ramdas Nayak book, textbook of pathology by Hers Mohan, pathological review book, and Pathology book by Vinay Kamalsan. So that's all about my today's lecture. Thank you very much. Hope it will make your fundamental clear about the fungal infection. If you have any question, you can ask in a comment section. I will surely answer. So that's all about the fungal infection. We will be right back with a new video. Till then, take care and friends. Bye bye.